Introducing the all-new Corolla.
After an operating loss of $33.7 million in fiscal year 2013, Public Auditor Doris Flores Brooks says Guam Memorial Hospital's financial health is flatlining. That analogy comes after she reviewed the latest audit of GMH released by Deloitte & Touche this week.
GMH, for all practical purposes, is almost on flatline. Is a patient in need of subsidies, is a patient of need of a major transfusion of cash for it to come alive.
Not denying that there is a cash flow problem at GMH, the hospital held a press conference this afternoon where CEO Joe Verga said this is not a management issue.
This is not a management let's cut expense issue. This is not a continually let's reduce. If the government wishes to reduce the services that GMH provides now, then yes, we could close beds, we could eliminate doctors, we can lay off nurses. If that's the track the government wishes to take, yes, you can do that. I don't think it is. I don't wish to, and neither does anyone else.
Verga pointed out that 51% of GMH's patients fall under the Medicaid, Medicare, or the medically indigent programs, which he says the hospital does not get sufficient reimbursements for. Brooks agrees with the revenue shortfall, and she points out that another 13% of the hospital's patients are uninsured. And for the 36% of patients who are insured, insurance payments have not gone up since 2006. As for the gaming tax, which brought in only $310,000, that's still held up at DOA and the legislature, Brooks says that tax is only a drop in the bucket compared to the hospital's $103 million in expenditures. But the CEO at the hospital does have sustainable revenue sources in mind.
I've proposed creating an uncompensated care trust fund. And everyone talks about where we're going to get the money from, I proposed one. I proposed the customs user fee, which would not burden the taxpayers of the island, would not affect visitors or would not affect tourism, could bring upwards of $20 million a year that we could then put into Medicaid for matching funds from Washington, which could bring upwards of $40 million into that trust fund that needs to be in a lockbox for GMH.
But that would require action from the legislature, which is why, even amidst criticism from lawmakers today, Verga says he looks forward to an oversight hearing called by Senator Dennis Rodriguez. And speaking of the legislature, Brooks says it's time for them and the rest of the island to realize the predicament our only public hospital is in and do something about it. Can GMH continue to operate as it has been?
I'm surprised it's still operating. As it is. Yeah.
Betsy Brown, PNC News.